Today I'll be going over Justice and Aging Support Services. Again, my name is Lauren Carden, and I'm the Director of California Elder Rights at Justice and Aging. So our roadmap for today, I'll go over Justice and Aging's mission and model of change. I'll talk about our areas of expertise. I'll give some examples of current advocacy that we're involved in, and then I'll have some information on how we can assist folks working at IOLTA-funded organizations. So who we are. So Justice and Aging is a national organization that uses the power of law to fight senior poverty by securing access to affordable health care, economic security, and the courts for older adults with limited resources. So we focus our efforts primarily on fighting for people who have been marginalized and excluded from justice, such as women, people of color, LGBTQ+ individuals, and people with limited English proficiency. So what is justice and aging? So we define this as the opportunity to live with dignity regardless of financial circumstances, free from worry, harm, and injustice caused by lack of healthcare, food, or safe place to sleep. And by using the law to strengthen the social safety net and remove barriers, we work to create the future we envision for our loved ones and ourselves. So at Justice and Aging, we are committed to advancing equity, both in our external work and also in our internal work environment. So in our external work, we focus on addressing the enduring harms and inequities caused by systemic racism and other forms of discrimination, especially those that uniquely impact low-income older adults and marginalized communities. And then internally, we work to recruit and retain a diverse staff and board, continually improving our understanding of equity principles. So our model of change. So our model of change is based on a combination of three main prongs. So training of direct service advocates, administrative advocacy, and litigation. And it acts kind of like a circular system. So first, we educate attorneys and advocates who work directly with older adults through our trainings, our webinars, our resources. And these methods or these tools give us feedback and information from the network, which then helps us identify systemic problems that we can advocate for at the local, state, and federal levels. And if the administrative advocacy does not resolve the issue, we have the ability to bring litigation to force changes in government policies. And if we successfully get those changes, we then train the network on these new laws, and the cycle kind of continues. So again, it doesn't all have to start at the training stage, but it all does work in kind of like a circular fashion. So our California work. So as I mentioned, we are a national organization, but we dedicate a significant portion of our work to California. I wanted to put up some statistics just to help kind of frame the issues that we're dealing with in California. And I'm sure people have seen these stats before, but by 2030, older adults will make up 1/4 of the population in California. And then currently, 20.6% of adults age 65 and older live in poverty in California. So the population of potential clients is vast and it's growing. And even folks who are not at an organization that's specifically dedicated to serving older adults, likely you're already serving older adults, and you'll continue to see those numbers increase in the next 5 years. So the issues impacting older adults really are crucial for all legal aid organizations to understand. So what Justice and Aging looks like in California. So we have 14 employees that are located in California, mainly in the Bay Area, Los Angeles, and Sacramento. I'm located in Oakland. We have a physical office in Los Angeles, but most of our work is remote, and most of the people work remotely. And I may not have said this before, but we are an IOLTA-funded support center. And we have 5 teams at Justice and Aging. We have the health team, economic security and housing, elder rights, litigation, and equity. Okay, so I wanted to go over some of our main areas of expertise, so you all can get a better idea of when or for what issues to reach out to us. So I'll go through some kind of like the main highlights in our areas of expertise. But we always encourage people, if there's an issue that you're having and you're not sure if we can offer assistance, we do encourage you to reach out, because it may be something that we do have knowledge about, or we can give you a referral to either an organization or an individual that we know has that expertise. So to start with healthcare, so our healthcare team is probably our longest standing team at Justice and Aging. Naturally, we focus on Medicare with an expertise in Medicare savings programs. We also specialize in Medi-Cal with expertise on issues affecting dual eligibles. And we're doing a lot of work currently on CalAIM. And we have subject matter experts on our team who focus on home and community-based services, long-term services and supports, assisted living, and oral health issues. For housing, so I guess within the last 5 years, we've been increasing our involvement in the housing space. We focus on maintaining accessible and affordable housing for older adults, tenants' rights issues, eviction defense, and I think kind of the most pressing issue currently in the housing world for older adults is preventing and ending older adult homelessness. For our economic security team, I think this is another one of our kind of longest standing areas of expertise. So we have subject matter experts in Social Security, SSI, SSDI, CAPI, and CalFresh. I think one of our newer teams is our Elder Rights team. We have built it up within the last few years. We have experts in elder abuse, neglect, and financial exploitation. And we've been increasing our expertise in guardianship, or it's called conservatorship in California, but in guardianship defense and alternatives to conservatorship. And recently we've been working a lot on reentry advocacy. We also focus on language and disability access through our equity team. And then kind of in addition to these substantive areas, we focus on legal services capacity building, which is a lot of the work that I do. So it's providing technical assistance to the legal aid organizations to improve the delivery of legal services to older adults. And kind of, any brainstorming with you for any kind of programmatic changes you can make that will help better serve the older adults. I wanted to dive a little deeper into the work we are doing in a couple of the specific areas. So most of this is through administrative advocacy, and I tried to highlight like our California work specifically. But as you'll notice as we go through the slides, some of the work does include our national work. Because again, a lot of these programs are national programs, but the impacts made on the national level do impact Californians. So to start for healthcare, so HSS is a widely used program by older adults, which enables them to remain in their homes. So we do a great deal of advocacy around the HSS program and around home and community-based services generally. We are currently working on improving access to HSS for older adults and adults with disabilities, particularly individuals experiencing homelessness, folks who are leaving incarceration, and people with Alzheimer's or dementia. And we are currently advocating with the Department of Healthcare Services to have IHSS screening included in pre-release Medi-Cal services under CalAIM. So those are services for justice-involved older adults. And we're doing a lot of that kind of pre-release advocacy in other areas as well. Here I just have some links to our recent resources. All of our, I think this is like the last slide I have today, but all of our resources are available on our website, and I will provide, the link is provided in the slides, which we will go over later on in the presentation. I did want to plug one upcoming webinar that we do have. So it's the last bullet point, understanding the barriers to accessing personal care services in California. So I believe that webinar is at the end of this month. And if you follow that link, it will take you to the page where you can sign up. And then I should say all of our when we hold webinars, all of our webinars, the recordings are then uploaded to our website. So you can still access the webinars even if you're not able to attend live. Okay, for Medi-Cal and Medicare, I guess I included stats on all these pages just to show the importance of the work. But over 1.5 million folks in California are dually eligible. So obviously that guides a lot of our work. We're currently advocating for Medi-Cal share of cost reform for older adults and people with disabilities. We're working to ensure that older adults and dual eligibles are equitably accessing CalAIM supports. And then our advocacy also includes advocating for effective implementation of an integrated process in Medicare D-SNPs. And again, I've included some links to recent Medi-Cal and Medicare resources. I think some of these are, all of them might be, national resources. But again, many of the national resources for Medicare will affect the work that you're doing in California as well. So economic security. A great deal of older adults receive SSI benefits. So we have been committed to doing advocacy work on SSI and with Social Security nationally. And we also have a specific focus in California. So we're involved in the Californians for SSI Coalition. We've also been advocating to restore and protect SSP grants and advocating for improvements to all the income programs to make it easier for older adults to obtain and keep benefits. And we are also involved in legislative advocacy to prevent cuts to the SSP benefits. When I didn't list I don't think I have an economic security resources slide. Again, that was because most of the resources are national, but again, they're available on our website and may be applicable to the work that you're doing in California. So housing, I think as most people know, homelessness is increasing, particularly for older adults. So in the housing realm, we are advocating to prevent and reduce older adult homelessness. An example of this was through recent legislative advocacy for a rental subsidy for older adults, which unfortunately did not pass this year, but we are committed to working to find a way to get that rental subsidy available for older adults to prevent homelessness. We also support legal aid organizations in working to maintain mobile home parks as a source of affordable housing for older adults. And this work usually comes, I think a lot of this work is detailing our administrative advocacy, but the work in maintaining mobile home parks is more of like in case consultations or technical assistance in that collaboration with legal aid organizations who are actually seeing the cases on the ground. I've listed some recent housing resources here that are available on our website. So elder rights. So our elder rights team is really focused on strengthening programs and support for older adults to prevent abuse. Some of our advocacy work. So we currently serve on the California Elder and Disability Justice Coordinating Council, which is a committee that was established under the Master Plan for Aging at the state level. And this committee is focused to preventing and addressing elder abuse, neglect, exploitation, and fraud. And in our role on the committee, we are advocating for increasing access to civil and criminal remedies for older adults and disabled victims of abuse, and exploring restorative justice alternatives for elder abuse and exploitation. I guess the other larger advocacy item in the elder rights realm was our recent work with providing comments on the notice of proposed rulemaking to modify the Older Americans Act to add new regulations for adult protective services. So again, this is federal regulations, but they will impact the APS system in California, and we plan to monitor implementation of those regulations. So legislative advocacy. In addition to our administrative advocacy, we're also involved in a lot of legislative advocacy measures. Recently, I guess an example is our recent budget advocacy. So as background, in the revision to the state budget in May, Governor Newsom announced cuts to the IHSS program, Home Safe, APS training, among other cuts that were offered. And we led, along with other partners, a statewide campaign to prevent these cuts from going into effect because of the detrimental effect that they would have on older adults in California, particularly undocumented older adults as well. We helped organize a sign-on letter with over 130 organizations signing on. We met with administration and we testified publicly at hearings opposing the cuts. And luckily, this was a good story. The legislature and governor agreed and signed a final budget that did not include these cuts, which again would have had a huge detrimental impact on older adults in California. So that's kind of one example of the legislative advocacy that we've done recently. Generally, in each legislative cycle, we offer support to bills, but they're not always successful, even though we try our hardest to get these measures passed. Our national work, I did want to touch on a little bit, again, of the national work that we do, because obviously of the impact that it does have on California. So I guess on these slides, I've just kind of highlighted different issues that we've been working on nationally that may affect clients that you're working with in California. So one recent advocacy win that we were heavily involved in were the changes to SSI's in-kind support and maintenance rules. So I think there's 3 rule changes that became effective September 30th of this year. And these rule changes, it's estimated, will lead to like 200,000 people no longer having a reduction in their SSI benefits for in-kind support and maintenance. We did have a recent webinar about these changes, which is available on our website. And we have putting another plug for an upcoming training for us. So we're going to be leading a pre-conference session at the Pathways to Justice conference later this month that will cover these changes in SSI and some of the other recent changes. So if you are going to that conference, we encourage you to come to our pre-conference session on the SSI program rule changes. And we also plan to have a new guide on ISM later this fall. I'll touch on the guardianship reform. So like I mentioned, we've been doing a lot of increased advocacy around guardianship reform. And again, this is what we refer to in California as conservatorships. But nationally, we're doing this, we're doing advocacy and education to increase the understanding of equity principles within the guardianship reform efforts. We had a cohort that we ran. It was the Advancing Guardianship Defense Intensive Technical Assistance Cohort Program, which kind of dealt with increasing the amount of guardianship defense work that programs throughout the country were doing. And we recently also published a series of issue briefs on addressing bias in the guardianship process, which is the link included on this slide. So a lot of advocacy we're doing in this space is really about making the guardianship process more person-centered. Okay, so some other national advocacy that we're currently working on. We are actively engaged in Medicaid estate recovery advocacy. And this is working to eliminate the law that requires state Medicaid programs to recover the costs of long-term care and other healthcare expenses through the estates of older adults, which many times is through the home of an older adult. And I think all healthcare advocates or legal aid attorneys know or are aware of estate recovery. This policy particularly harms marginalized communities and people of color. So we are collaborating with the National Association of Elder Law Attorneys to really elevate the personal stories of folks affected by estate recovery. And we're also working with Congress to advance legislation to eliminate or mitigate the impacts of Medicaid estate recovery. So that is kind of ongoing work. And then the last national work that I wanted to touch on, so nursing facility quality. So we're advocating to improve the quality of care in nursing facilities. And working to kind of empower residents and their families to exercise their rights in nursing facilities. So recently we made recommendations through the Centers for Medicare and Medicaid Services to improve the kind of consumer-focused information to allow residents to better understand their rights and then better be able to kind of exercise those rights and advocate for themselves. Our litigation work. So I'm not going to go through all of these in detail, but I just wanted to mention that we also engage in litigation many times with legal aid partners. These are all some recent litigation victories, again, at kind of the national level. I'm not going to go into each of them, but the Campos decision, so the last bullet point, which impacts SSI recipients who got overpayments during COVID. So we did create a helpful advocates guide for advocates to know how to help clients who may be impacted by the settlement or experiencing this issue. So that, again, is available on our website. And also more information about our litigation victories is generally posted on our website as well. The nuclear slide. So I wanted to highlight that another branch of our national work, which is kind of confusing to folks when they initially hear about our organization. So that's the National Center on Law and Elder Rights, or NCLER. So Justice and Aging administers NCLER under a contract from the Federal Administration for Community Living. And NCLER is kind of a national resource center for legal services and aging and disability advocates focused on the legal rights of older adults. Similar to Justice and Aging, NCLER provides kind of free webinars, trainings, materials. There are several national resources available on the NCLER website that would be helpful for California advocates. And I have the link for the website on this slide, but it's also on Justice and Aging's website as well. And generally, we try not to duplicate trainings between NCLER and Justice and Aging. So we hope that folks on our email list are not inundated with the amount of trainings that we create to have available. But there is kind of this distinction between NCLER and Justice and Aging's webinars. So in the last few minutes, I just wanted to reiterate how Justice and Aging can help legal aid organizations with their direct services work. So kind of like most of the other support centers had detailed, we're available to offer a variety of services to the IALTA-funded legal aid organizations. I think the most common or well-known form of assistance is through case consults. So that's brainstorming solutions to cases with you, assisting with research on legal issues, directing you to the right resources. And in terms of the research on legal issues, we definitely encourage people to reach out because we are kind of constantly in the weeds of a lot of these regulations and laws. So something that may take you a significant amount of time to research may be a quick answer from us. So we really do want to be available as that resource to make your lives easier. We also, kind of as I mentioned earlier, we also provide technical assistance on like legal service delivery issues. So that could look like discussing changes to an intake process, brainstorming outreach strategies, like data collection. It's really any challenge you're having that is impacting your ability to serve older adults. For resources and referrals, we hope we can serve as like a hub of information for legal aid organizations. So a place where you can come get resources and referrals as needed. Again, if we can't answer a question, we do have a broad network, so we can hopefully connect you with someone who will have the answer or with a resource that may be helpful with, whatever issue you're currently working on. Trainings, obviously we offer a lot of trainings. One thing I wanted to note here, so generally we just provide our trainings online, but we do have the ability to provide in-person trainings for organizations. You just have to kind of reach out to us and we can coordinate that with you. And then finally, we offer the litigation support and can co-counsel with orgs on impact litigation cases. And then just a final plug, we also want to hear from you. So if you may not have a question about a case or need specific assistance, we do benefit from knowing what you're seeing in the community. So even if it might not be a question, if you're seeing an issue that could be systemic, or you're just curious if anyone else is experiencing the same issue, please reach out to us because we'd love to hear from you all. And then just our last slides are kind of just information for you all. You can join our network. That's how you get information about our new trainings and resources. And then the email address listed here is also the email address you can use to reach out to us for case consults or technical assistance, which is info@justiceandaging.org. And then finally, the links to our website. So this is a link to our website. We have the updated resource library. It's hopefully more user-friendly now. So we're always also welcome feedback on anything, or if you can't find something, you can also reach out to me or to our email address for assistance with finding resources. And then I've also included the NICLR website as well. So that was all I had for you all today.